In this video, I'm going to talk about 5 symptoms to never ignore. The number 1 killer in the Western world is heart disease, and 2 out of every 3 people who have a heart attack will have chest pain. Someone in the United States is having a heart attack every 40 seconds. So if you have chest pain, go see your doctor. Go to the urgent care, go to the emergency room, go see someone ASAP. I have diagnosed and treated hundreds of people for their heart attacks as a young physician. Now I treat infections that complicate heart disease. It is true, most people who have chest pain don't have a heart attack, but why take that chance? We have very good tests and tools to take the guesswork out of heart disease. If you have a heart attack, we test for leaky enzymes called troponins. If you have abnormal electrical activity, we can get you an EKG and detect that. We can also visualize your heart with an echocardiogram and look at your heart vessels with a cardiac cath. Now, of course, if you're at high risk for a heart attack, you don't have to be a sitting duck and wait for it. A cardiologist can help you reduce your risks, and it begins with changing your lifestyle. Start by eating during the daytime and avoiding food 2 hours before bedtime and those midnight snacks. And when you eat, fill yourself up with unprocessed whole plants like beans and vegetables, and reduce your saturated animal fat in meat and dairy to really once a day or less. What's bad for the heart is bad for every organ in your body. Now, people who are at risk of heart disease are also at risk for strokes. If you have a sudden, intense, and persistent headache, you may be having a sentinel headache before a life-threatening bleed in your brain. Up to 65% of people with a stroke will have some form of headache. Now, about 10 years ago, a relative of mine called me up complaining of a headache and the inability to move the right side of his body. So I told him that wasn't normal and that he should call 911 and go to the emergency room. So they took him to his local community hospital that wasn't a stroke center. And the doctor performed a CAT scan, which turned out to be normal. So they sent him home. Well, the problem is he was still having problems moving his right side. And he called me from home complaining that it seemed to be getting worse. So I told him to go to another emergency room that was a major hospital able to handle strokes and to get an MRI because it's a more detailed scan. Well, he went back to the original community hospital because it was closest to his house. And this time they agreed they were going to get the MRI, but they couldn't do it till the morning. So they admitted him for observation. Well, by morning time, he progressed even more. His MRI was positive and his symptoms were worsening because he had brain swelling. You know, this sounds ridiculous, but this is exactly what happened. And so the moral of the story is basically, if you think you have stroke symptoms, go to a stroke center. Urgent cares in small community hospitals may not have the ability to care for acute strokes. And by the way, my relative survived because I got him transferred to a major university. Blood flow, if you haven't noticed, is super important for your health, and all your organs contribute to the health of your blood vessels, including your kidney, which simply filters blood to make urine. So if you're peeing at night, that's not normal and shouldn't be ignored. Now, it could be that you're drinking too close to bedtime, and simply stopping liquid for 2 hours prior to sleeping will do the trick. Or it could reflect something else going wrong with your metabolism, like maybe your inability to tolerate glucose, and you may have diabetes. There could be a problem with your bladder storage so that you are leaking urine, or it could be that you have an obstruction caused by your prostate or nerve damage causing your bladder not to contract properly. These are all possibilities and require a physician to diagnose. The consequences could be kidney injury and life-threatening urinary tract infections. So please see a doctor and get a proper workup if you're urinating at night. And speaking of urine, if you are burning when you urinate or are urinating frequently, you may have a urinary tract infection. And this is very common in people who have metabolic disorders, especially diabetes and cardiovascular disease. This is actually very dangerous, especially in older individuals with multiple medical problems. Now, I have another relative story. So this relative was having burning in frequency, and she did the right thing. She went to the urgent care and they did a urinary dipstick to confirm she had an infection and gave her antibiotics based on their best guess. Well, she didn't get better. She went back to the urgent care and they gave her another antibiotic. Well, she didn't get get better, she started to vomit, which made her get dehydrated. Long story short, she went to a third urgent care, basically did a dipstick, confirmed she had a urinary tract infection, and sent her home with a third course of antibiotic. Well, the problem is, if you're vomiting, you can't take your antibiotics because you'll just vomit them up. So I told her to go to the emergency room, who finally did a proper workup. She got blood cultures, a urine culture, as well as blood chemistries and a complete blood count. And they diagnosed her with pyelonephritis, which is an infection of her kidney. So a simple urinary tract infection should have been treated in the beginning properly with a urine culture. But because nobody did a urine culture in the urgent care, her simple bladder infection became a 1-week kidney infection. And that translated into a 3-week rehabilitation, because getting an infection will wipe you out, and she couldn't walk for a week because she was upchucking during that time. So the moral of the story is, if you have a urinary tract infection, please insist on getting a urine culture so that you can get treated properly in the beginning. If your kidneys, heart, or liver don't work well, you're gonna back up fluid, and it's gonna show in your legs as edema. And sometimes you may be falling asleep at night in a chair, and simply not doing that will relieve the edema. But leg swelling should never be ignored, and you need to see a doctor to find out why. In the ICU, I see massive swelling all over the body when people are super inflamed. And when they become better and the inflammation resolves, their swelling resolves. So sometimes the fluid builds up so slowly that people just notice that their legs are a little bit heavy and that their shoes get a little bit tight. Unfortunately, the heaviness will make you less active and your gait unstable. And therefore, you're going to build up more fluid from inactivity. Your shoes will become tight, leading to ulcers and blisters that get infected, can cause cellulitis and bone infections. So please don't ignore your body when it changes. What I have been describing are all signs of inflammation. They may start subtle, but if left unaddressed, can significantly reduce your quality of life and can take your life. Please see a medical doctor and get a proper workup. I hope this video was helpful. And if you like this video, join me in my next one. See you there.